actually going to be recorded. Now, I do want people just to know that if people are wanting a copy of the presentation afterwards, I'm very fine with that. I'm fine with, with Wendy or with Stacy, just sending that out to everybody. So that part is fine. We'll share it right now and then send it out afterwards. So one of the things that has really been big, I would say, in my learning over the last period of time is starting to understand in a much better way, how is it that we can contribute to wellness? And that has become big in my learning because of work that we've been doing for such a long period of time, looking at prevention strategies and prevention of violence strategies, together with protection strategies, and how do we understand how it is that we contribute to protection. It's interesting. Over the last 8 years, I've been quite deeply involved in research around this particular area. And one of the things that has really brought me to a better understanding of wellness has been starting to better understand determinants of health. And not just understand determinants of health, but starting to better understand Indigenous determinants of health. And how is it that we can best really participate and contribute to the wellness that is so often the goal for our families and for our nations. Now, I'm not going to, now, if you just change the slide, Wendy, this is just, I'll just probably just get you just to move through that one quickly, just because we actually have talked a little bit about the territory that we're coming from today, but I just want to stay just on this one for a little bit, because one of the things that we have greatly learned in the work that we do within programs of the Canadian Red Cross is we have started to look at what is the foundational information and what is the foundation that we need to have that we can start putting lots of our content on, right from how do we understand challenges within community to how do we best contribute towards the wellness within community. I thought what I would do is talk a little bit first about some of the research that we've actually done and a little bit of the learning that we've had. And then I thought I'm going to come back to really us understanding and coming to a better understanding of determinants of health. So if we look at the next slide, Wendy, I thought this would actually be a really good starting place to get into this conversation. One of the things that I've been involved in prevention education, like I had said, for 25 years, and in our education, one of the things that we really understood very early on is that we had to have a very deep understanding of the challenges that we too often have within our family lives as well as our community lives. And so it was really interesting when we started to look at how to better understand prevention education programs. I didn't necessarily want to first and look actually at the prevention education programs themselves. One of the things that we really wanted to start looking at is we wanted to look actually at more at content around community mobilization, and how is it that we need to work together if we're going to start really challenging and working away from the challenges that we have, within family and within community. And so we started this particular research project, and our main question in the research project was what aspects of the community mobilization program or project or process are working to bring about change. And the reason that we had really wanted to go into that place of understanding was very much because what we know about harm and what we know about challenges is that there has been a long process. There has been many different events that have actually contributed to the challenges often that we sit with today. And what we wanted to better understand is whether or not we were actually contributing to moving away from those challenges. And so it was really interesting. One of the big things that we learned around this is that when we started asking people and we started asking, working with community, I mean, well, we've worked with community for many years, but the communities that we were doing research work with, when we started to ask communities this question and many questions, around this, what we were realizing is that when communities talk about moving in a process away from violence or moving to a process of wellness, they often would describe wellness as being in a space in the absence of harm. And that was a real challenge for us. That was a real challenge for us to hear. And the reason being is that in hearing that, we felt that the absence of harm isn't necessarily wellness. That doesn't necessarily define what wellness is. Really, the absence of harm is very good in and of itself, but it's halfway. It's halfway on the journey. And so that understanding really helped us to start looking at a conceptual model that we could actually start to look at framing our work in a better way. And so if we look at the next slide, this actually starts to look through some of the things that we started to actually better understand. And I'm not going to spend too much time here because this is something that we'll actually come back to. But it was interesting in that what we had realized when we started asking communities about their movement away from harm was that their understanding really situated in the cycle of violence as opposed to the circle of wellness. And for us, that was really critical information. That was really important for us to know and to better understand. So I'm not going to spend too much time there because, like I said, we are going to come back to that. But what I want to do is I want to more introduce why we started to look at better integrating our understanding around determinants of health, and why it was that we needed to start looking differently at the content that we were focusing on, and not just the content, but looking at maybe the questions that we were, I know, helping to be highlighted, I think, within community work that we were doing. If we look at the next quote, I pulled a few different quotes from one of my favorite resources. And now the article that I had actually had Kelly send out to everybody was looking at transforming our realities. And what I really liked about that article, it was really interesting. We talked a little bit about what would be a good article to highlight and to look at if we were looking at determinants of health. And I have many different favorite articles when I start to look at determinants of health. There's several that come to mind. But what I really liked about Transforming Our Realities is that it highlighted within it several different lenses that I think we need to look at and better understand when we start to look at determinants of health. And it really started with looking at the structural in terms of the structural determinants. And it also flowed into the traditional determinants as well as the values-based determinants. And it gave us a really good overview of different areas of thinking, as well as different nations' way of thinking, as well as different lenses, right from justice to health, to education, to social services, to, I mean, when we started to look at that as a document, it really gave you the insight around who, not only who is focusing around there, but the intersectionality that needs to be considered when we start to look at determinants of health. It's interesting. Determinants of health isn't a new conversation I think for all of us. I mean, it's a conversation that we've all been a part of for a long time. But within Indigenous communities, it is, and it's not new within Indigenous communities either, but it's definitely understood in a different way within Indigenous communities. And how it changes when we start to really look at it and integrate what is different is that we have to understand there's a couple different areas that we have to better understand. We have to understand how colonization plays a role within determinants of health in a political way, in an economic way, and in a and in a and in a cultural way. We have to understand then at the opposite of that, the role that self-determination plays. And so those are, when we start to look across, those are the two different pathways that we would actually really want to better understand. Oh, sorry. So Wendy, I'm going to get you to show that, and we won't spend much time here either, but I thought I wanted to just, going back to the conceptual framework. When we started to look at how we need to understand the impacts of colonization within determinants of health, this actually is a really good diagram and model that helps us to understand that. Many times when we start to look at the impacts of colonization, what we tend to do is we tend to look at particular events, and we give those particular events more greater value, or say that they were more detrimental than other events. And I'll give an example of that. When we give the example of residential schools and how residential schools have impacted our communities, residential schools have greatly impacted our communities. We know that, and I believe that we would all be in deep agreement with that. And it has really come to light through the discovery of our children that have been buried around various residential schools. So that's really come back into light. So we understand that. But together with that, one of the things that we also have to understand is we have to understand various events that happened before residential school and various events that have happened since residential school. And know that when we're talking about historical harm, we're actually talking about multi-layered aspects. So sometimes we might know one particular area of harm, but that doesn't necessarily mean that we know all the areas of harm. And so we give one event that happened within people's lives greater weight than we might give other events even though disease may have actually created as much harm within communities as residential school, even though stolen resources and the impact to land has actually impacted Indigenous communities as much as residential schools, even though when we look at murdered and missing Indigenous women's, and when really missing persons first began, which was really very soon after contact, that has actually ultimately had as much impact as residential schools. What happens is that we often will get focused on a particular event in the absence of looking at the other events that really intersect with that particular event. And what's important to know about that is that we have spent a great deal of time better learning about harm that happens within community. And it's important learning. I'm not saying that that's not important learning, because it's very, very important learning. But what happens is that if we only spend our time focusing on understanding harm within community, that means that the discussion doesn't ever go to the place of what creates strength within community. Then it takes away from that conversation. So it's really interesting for us. One of the things that we learned so much with community over the last few years is that often programs come into community and focus on the deficit and focus on the challenges within the community. They focus on the statistics that they understand community through. And all of those things are related to this. When we look at this history of harm, this helps us to better understand those deficits, and it helps us to understand the statistics that define funding, that define, lots of times our knowledge base, but don't necessarily define what is actually the best information and the best direction for community. And sometimes we get caught in this place. And we get caught in that place because we actually really do want to participate in wellness. But in the absence of knowing what really is going to contribute to wellness, what is the processes that's going to contribute to wellness, we often stay in the place that we know and that we've come to know. And what we've often come to know is the deficits within community. If we look at the next slide, one of the things that it says here, it's like when we look at determinants of health provide context for the inequity, which is very important. And we may see and guide responses that are holistic, culturally safe, decolonizing, and centered on the strengths of Indigenous peoples. It's really important that we start to understand that lens, that how do the determinants of health help us to better understand all of those pieces as opposed to just the deficit piece. For us, it's interesting in that we also have to unpack what it is that we are focused on, and so if we look at the next slide, there, one of the things that we really realized is that there was a few different areas that we really were focused on. They were great areas, and so but we had to really define the work within these. And so one of the areas that we really focus on is we know that we have to do no harm. But what does that mean when we actually start talking about do no harm? And so for us, we started to look at how do it says like we remain sure that our policies, programs, and operations are culturally safe, informed by community, and do not infringe or jeopardize the inherent rights of Indigenous peoples. And so when we started to look at our lens of do no harm, we were realizing that our lens of do no harm was focused on us understanding history. It wasn't necessarily focused on us understanding wellness, and the wellness aspect or the cultural aspect of history. One of the things that we realized is that we often worked from a place of understanding vulnerability. But as we really delved into understanding vulnerability, what we realized is that if you take a determinants of health approach, What it helps you translate that to is understanding structural vulnerability. And when we look at structural vulnerability, that's the result of historical and ongoing harm, and that this harm was and is rooted in colonial structures imposed on Indigenous peoples. And so when we start to look at vulnerability, we can start to then frame it in a way that says, understand vulnerability in the context of being an advocate for structural change, not because the people that you're working with are vulnerable people. It's that there is structures that are creating vulnerable scenarios. The other thing that really looking at a determinants of health lens helped us to better understand was intersectionality. And that if we start to look at intersectionality, it helps us to better look at one, what does, how is colonization at the root of things, but how is it that we understand culture and language? How do we understand gender? How do we understand family violence? How do we understand education and literacy? What are the intersects of these different things? And how is it that we can best understand those intersects and actually work with them as actually being related to one another? So for us, those were three different terms that we really realized were very important for us to reframe and almost redefine for ourselves so that they could be guides around how we understood those different areas. If you look at the next quote, this is actually from the paper that's Transforming Our Realities, and Charlotte Redding, she goes by Charlotte Lopi actually, and today she's a professor in University of Victoria, and a lot of her work has been in Indigenous determinants of health. She's really taken a lead here, and she really talks about the fact that Indigenous communities are cohesive. They're cohesive in nature, and systems within Indigenous communities are also cohesive in nature if they are operating in a traditional way, if they're operating in a cultural way. But in today's environment, there has been so much systemic discrimination amongst systems that what's happening is that the intersect of that discrimination is creating the foundation, really for greater disparity, and a greater disparity that we often get really stuck within. If we look at the next slide, this is this is one of the ways that we have really come to understand determinants of health. And if we look at it through an intersectoral lens, this actually, although it's, in as a figure is kind of put into a wheel. It's what's important here is that it helps us to see that every area that we look at, we can look through the lens of whether or not that creates a deficit, or whether or not, we can look at that differently. Often within our programs that we work within, this is actually how we see that. We often see these statistics related around here. So when we look at family violence, we can see residential schools and other harms of colonization have disrupted supportive relationships in family community. And yet when we look at education and literacy, we can see that, Indigenous peoples are less likely to finish high school, and fewer than 10% have a university degree. When we start to look around this as a determinants of health lens, what happens is that we really realize that much of what we do is actually rooted within these statistics. And the challenge with being rooted within statistics is that we're rooted in the deficit. We're rooted in the just really the detriment of the area. Whereas if we can refocus that and say, how is it that we could maybe relook at this through a self-determination or through a powerful, through a different lens, through it and through a more of the source of wellness as opposed to the source of deficit, then how does that look different? And so when we look at language and culture, and we look to say, do our programs or are our programs rooted within Indigenous language? Is healthcare something that is accessible? Or what, when we look at healthcare, do we look at healthcare in a way that actually, acknowledges traditional healthcare to the same extent as Western healthcare is acknowledged? That would be the change that we would actually see within that, in that here we're looking at these, and often, I think what I want to highlight is that what we understand when we look at even this wheel is we often look at the colonization aspect of this, whereas when we're working closely with community will actually look at the self-determination aspect of this wheel and give you absolutely different information than what is around the wheel in terms of the statistics. When community looks through this, they look through it and they often attribute it to their value system. And they connect it to their traditional ways of knowing or their traditional ways of understanding information. So when we look at the next slide, I wanted to show you what, I wanted to show you just from a values place, what does that look like? And this is looking at the Inuit principles and how they understand values, in that, if they are to look at determinants of health, often what will be focused on will be this type of information, where they will look at this and say, first off, we understand our relationship with determinants of health through the 4 big laws. And the 4 big laws are the 4 that are in kind of a pinkish color, that are right around, the child-centered and right around all my relations. And so for, within Inuit communities, they will say, how do we understand the 4 big laws? Because the 4 big laws are about our relationship, to our culture and to our language. They are about our relationship to our location, and to our grounding. They help us, before we look at education or support networks, before we look at housing or land, we have to look first through the big laws, because they help us in understanding in understanding our relation to those things. And I'm not going to actually look at that particular quote. I'm going to, if we can just maybe go to the next slide. I want to look at other aspects or other things that help us to better understand how we look at determinants of health from a lens and from a place where community is defining how to contribute to self-determination, as opposed to us looking through the lens of challenge or the lens of deficit, which is often a colonized lens of looking through this. We're really blessed, in many ways, in Canada, in that we have had so many collectives and groups of people, groups of Indigenous people that have come together and really defined ever so well how to actually look and contribute to determinants of health in a way that contributes to self-determination. And so, when Murray Sinclair led the Truth and Reconciliation Commission, what they came to is they came to the calls to action. And in coming to the calls to action, that helped to define how it is that we can contribute to understanding aspects of harm, but understanding them in a way that contributes to self-determination. When the Murdered and Missing Indigenous Women's Inquiry happened within Canada, what happened there is, again, many people came together over months in several different focus groups with hundreds of people, and they came to a place of giving us the calls to justice. And the calls to justice are rooted in a way and worded in a way that help us to best understand how do we look at disparity, but contribute towards change in a way that's actually rooted in self-determination. When we started to look at, the United Nations Declaration on the Rights of Indigenous Peoples, again, this was another driver that looked specifically at how do we contribute, what is the best way we can contribute in a way that helps us understand how to do this work in a way that contributes to self-determination, as opposed to doing this work in a way that just combats the disparity that often brought us to a place of being involved in the work that we're actually doing. And so for us, one thing that became really clear is that, coming back, and I know that I showed you our Indigenous peoples, framework and the different, pieces of that near the beginning of the presentation. For us, this was our way of saying, if we can take these three enabling protection frameworks, and if we can funnel those into and become the drivers of how it is that we work, how it is that we collaborate, and how we develop programs with and for community, then ideally for us, this brings us to a place then that we are truly contributing in ways that are actually helping to recreate that foundation of self-determination that communities really, really struggle with, because they're really caught in the deficit. They're caught in the deficit, and many times so much of our work doesn't contribute to bringing them, to helping come out of the deficits, if that makes sense. It's really interesting. I put this last quote in here. If you go to the next slide, it says, and this is, one of the researchers that we work really closely with is a woman from Arviat Nunavut, Shelley Cardinal, and she just said, the thing that is stunning is that when you start to do research into Inuit worldviews, it's all there. It's all laid out. All the answers are there. When we Southerners came into the communities, we just assumed they didn't have anything. And yet they had survived for thousands of years in the Arctic. They had it all, but we stomped on it. A lot of what we're trying to do is make space to bring back the richness that is already a part of culture and cultural teachings. And I think with that quote, what I'm thinking is that I know that we were wanting to take about a 5-minute break, and I know that it's a little bit past what we were going to take for a break, but maybe we should just take a little bit of break. And then what I'd like to do is I'd like to come back, and I have just some questions that I'm wanting to go through when we come back. So why don't we take let's take a 5-minute break. I don't want to take too long of a break because I'd like to be able to come back and have about 15 minutes for questions. So let's do that now.
So we'll see everybody back at 4:02.